Hey everybody, and welcome back to another video here at Whiteboard Medicine. It has been too long. I hope everybody has enjoyed their summer thus far. Today we're going to be talking about West Nile virus. And this was the people have spoken. So if we pull up our YouTube channel here and we go to community, we put a poll out about a week ago asking, we're going to ramp back up. What topic do you want us to cover next? And you can see West Nile virus and monkeypox were neck and neck at 42% each. So we're going to start with West Nile virus, but we think that since there was a tie, we probably will have to cover monkeypox as well. Did just want to do a shout out. If you search Whiteboard Medicine monkeypox, we actually put out a video on monkeypox. This was during the first monkeypox outbreak about 2 years ago. So there's a lot in here just about monkeypox and the disease in general that's very applicable to what is going on right now. But it certainly doesn't have the updates on the current spread of monkeypox, which we'll probably come up with an update video. But if you're interested in learning more about monkeypox, just in the YouTube search, Whiteboard Medicine monkeypox, and that'll pop up. Today, though, we're going to be talking about West Nile virus. As a secondary reminder, we did put out a video on mosquito season, what you should know. That was actually last year. And in this video, we talk about a lot about mosquito-borne illnesses in general, mosquito anatomy, life cycle myth busting, how mosquitoes spread disease case counts, etc., etc. We'll link this in this video's description if you want just some general overview of mosquito-borne illness in general, because today we're going to dive into the specifics of West Nile virus itself. We're going to start with the virology of West Nile virus. We'll talk about how it's transmitted, the signs and symptoms, the diagnosis, treatment, prevention, and then at the end we will go into the current state of things. But we're going to start with some of the general introductory stuff. We will put timestamps in this video's description if you want to skip around. No further ado, 30-second break for the introduction, then we'll dive in.
Hey everybody, and welcome to Whiteboard Medicine. We appreciate you checking out the video. Here at Whiteboard Medicine, our goal is to create medical education content for all types of interested learners. That includes videos, practice questions, study resources, and much more. We would love for you to join our community by subscribing, hit that bell button. We're also working to build a high-yield Patreon page. It's going to be full of practice questions, video outlines, notes, commercial-free content, and much more.
None of these videos are intended to be acted upon as medical advice. Please pause the video here and read this disclaimer in its entirety before moving on.
All right, thanks for sticking around. So, West Nile virus, a little bit of an introduction to West Nile virus. This is a mosquito-borne illness, and we are talking of it today because it has been spreading throughout the USA, but this is an international disease. It's called West Nile virus because it was first identified west of the Nile. So there's many countries that get West Nile virus and West Nile virus disease. Currently, there's an outbreak in the USA. That is what is closest to us here at Whiteboard Medicine because we live in the USA. But certainly, there are other countries and other continents struggling with West Nile virus as well. In the US, it's primarily a summer and fall illness. Obviously, it's mosquito-borne, so it follows the life cycle of the mosquitoes. And obviously, in winter, mosquitoes are not present in biting people. So it's a summer and fall disease. That's why it's big season right now, and probably will get a little bit worse before it gets better. There are no known vaccines to prevent West Nile virus. When it comes to West Nile virus, the disease itself, of every 5 people that get the virus in their system, only 1 in 5 will get ill. And that 1 in 5 is about minor symptoms, which we'll talk more about. So obviously it's about 20% of people who get bit by a mosquito with West Nile virus and get the virus in their bloodstream. Only about 20% of them actually get sick. A much smaller number, about 1 in 150 people, get critically ill. They get that neuroinvasive West Nile disease, the severe disease that can be deadly. So very few people of all those infected get this neuroinvasive deadly form of West Nile virus, although if you do, certainly you can get very, very sick. So quick peek into the virology being what is the virus. All right, so for those interested, and I'll go quick because it probably doesn't tickle the fancy of a lot of people, but this is an enveloped single-stranded RNA virus. What does that mean? Well, if we peek over to the right here, that means that the genetic material of the virus is a single strand of RNA, ribonucleic acid. That's in comparison to DNA, deoxyribonucleic acid, so it's a single-stranded RNA virus. Okay, it also has an envelope, meaning it has an outer coating, and that envelope does affect its kind of virology, the way it behaves, although we won't dive into it too much in this video itself. It is part of the Flaviviridae family, which is a larger family of viruses, and you'll see it referred to as an arbovirus. An arbovirus just means that it is a virus that is transmitted by insect bites, and in this case we talked about how it is mosquito bites that transmits this virus. So it is an arbovirus, which is kind of an umbrella term for all those viruses spread by insect bites. Eastern equine encephalitis has gotten some news cycle as well. That's spread by mosquitoes. That would also be considered an arbovirus. Okay, so transmission. How can you get West Nile virus? Well, West Nile virus is primarily a disease of mosquitoes and birds. All right, so this is a mosquito. It's the species of mosquito most likely to transmit West Nile virus is the Culex species of mosquito. In the life cycle of West Nile is mosquito to bird, bird back to mosquito, right? So the mosquito bites the bird. If the bird is infected with West Nile virus, the mosquito sucks blood with West Nile virus. The virus gets into the mosquito system and travels to its salivary glands. And then it goes and bites a different bird, and some of that virus in the mosquito salivary glands gets inserted into the bird's bloodstream and causes the bird to have West Nile virus. It's been found in over 300 species of birds, so lots of different birds can get this, but it affects birds differently. Certain birds can die from it, okay? Birds like crows can commonly die from it. Other birds don't die from it. So there's a variety of illness depending on the bird's species. In addition to this, birds can give it to themselves. So predator birds that eat other bird species, if that bird is infected with West Nile virus and a bird eats that dead bird with West Nile virus, it can get the West Nile virus from the dead infected bird. So eating infected birds can be a way of bird-to-bird transmission. Unfortunately, mosquitoes don't just bite birds, right? They also go and bite humans. So if a mosquito is infected and has the virus in its salivary glands, then it goes and bites a human, it can give that human West Nile virus. Now, humans are considered dead-end hosts. And what that means is that once it is in a human, if a mosquito then bites that human with West Nile virus, the human cannot, I'm going to do a different color, let's do red, cannot give it back to the mosquito. That can't happen. And the reason being is because the viral load, the amount of virus in the blood is not high enough, so low viral load, for the mosquito that bites the infected human to get enough virus to spread it to something else. And that's why we're considered dead-end hosts, because we cannot give it back to a mosquito to then spread to others. We can, though, give it to one another. All right, there is a human-to-human possibility of transmission. This is very uncommon, and the times we have seen it is with blood transfusions, right? So if you are infected and donate blood, it's a very small chance, but there's a chance that whoever receives that blood could get West Nile virus. They recommend not donating blood for about 120 days after you have gotten West Nile virus. They've seen it very uncommonly in organ transplant patients. Let's say you have West Nile virus, and then you donate an organ. The person that receives that organ has the possibility of getting West Nile virus. Mothers can transmit it in breast milk. So if you are breastfeeding, you get West Nile virus, you could transmit it through your breast milk to the baby. And then very rarely, only a couple cases quoted, transplacental, meaning if the mom is pregnant and gets West Nile virus, she could transmit that virus through her placenta into her baby. But very uncommon, not a lot of cases of any of these documented, but certainly possible. The other thing that people ask about is, can we get it from birds? And as far as we are aware, no one has caught it from a bird, not eating a bird or handling a bird. Now, the CDC does recommend you wear gloves if you're handling a dead bird because there's a possibility of transmission here, but there's been no known cases of a person eating an infected bird or handling a dead bird that was infected and then getting the West Nile virus from the bird. All right, so mosquitoes give it to birds who give it back to mosquitoes. Birds can give it to birds if they eat a dead and infected bird. Mosquitoes give it to humans, but that's a dead-end host. Humans cannot give it back to mosquitoes. Humans can give it to one another, but very uncommon, and we talked about the ways. And then birds do not seem to be able to give it to humans, although there's a recommendation to wear gloves and handle dead birds with care and all that kind of stuff. Once you get the virus, the incubation period, the amount of time it takes before you start to show symptoms is about 3 to 14 days. So a couple days up until about 2 weeks, right? So it's always good to know how long it can be in your system before it would manifest with any symptoms. All right, so that's the transmission of it. Well, what are the signs and symptoms? We said incubation period is 3 to 14 days. What are the signs and symptoms? Well, as we talked about above, only 1 in 5 people, we phrased this wrong. 1 in 5 people do not remain asymptomatic. So only 20% of those infected have symptoms. So 80% remain asymptomatic. Apologies for that typo. Hopefully it makes sense. We're just going to state it again to be clear. 1 in 5 people develop symptoms. 80% of people infected remain asymptomatic. Okay? And then 1 in 150 people develop the severe neuroinvasive disease. So we divide this up into kind of 2 different titles. West Nile fever, this would be considered kind of the minor version of disease, right? And we said about 20% of people who get the West Nile virus develop symptoms, and those 20% develop this West Nile fever. And this is kind of just generic viral syndrome symptoms, right? These kind of look like symptoms you'd get if you had the flu. You get a fever, you get a headache, you get body aches or myalgias, a little nausea, vomiting, and GI upset. Lymphadenopathy, it means swollen lymph nodes. Okay, so you can get swollen lymph nodes in your neck or your groin. And then a small percentage, so a small percent of people can develop a rash, although that's certainly not a large percent of people. All right, of those unlucky, the unlucky 1 in 150 of people who get West Nile virus can develop severe disease. And this is that neuroinvasive West Nile virus. This is the feared complication of West Nile virus. This is if you've seen people say meningitis. The meninges are the coating of the brain. Meningitis is inflammation, itis of the meninges. Encephalitis, right? This is encephalitis is inflammation of the brain. There's like meningoencephalitis. Combining these two, you can get inflammation of your spinal cord. This is all neuroinvasive disease invading your neurosystem, your brain and spinal cord. And here you get very sick, high fevers, neck stiffness or pain. This is kind of a generic symptom of this meningitis encephalitis, right? When you bend your neck, your spinal cord goes from your brain and your head down your neck into your back, right? So if you're bending your neck, it pulls on your spinal cord a little bit. And if you have inflammation of those meninges or the coating, it causes pain. So you get neck stiffness, neck pain, neck rigidity. You can get stupor or coma, so altered mental status. Coma, you can get seizures, weakness, arm, leg, both, neither. And it can go so far as paralysis. You can get deep coma with paralysis. And there's a fair amount of mortality with this. Patients get really, really sick, and they can have permanent neurodeficits. They can even die from this disease. So how do we diagnose it then? Well, the diagnosis can be really tough. If you were to go to the hospital and get evaluated and you had this West Nile fever version, you'd kind of just have these non-specific findings, right? You might have a little bit of an increased white blood cell count. It's just generic kind of non-specific inflammation or reactive disease, right? You might be a little dehydrated if you're having nausea, vomiting, or decreased oral intake. But you don't really have a lot of lab abnormalities. If they were to get a CT of your head, a CAT scan of your head, it most likely would be negative. There's not good serum tests for the virus itself. But if you were to get really sick and get the severe West Nile disease, this neuroinvasive disease, this is where you'd have to get a lumbar puncture. A lumbar puncture is a spinal tap. It's where you poke a needle in the lower back through the skin into the spinal canal, and you get a sample of the cerebrospinal fluid, the CSF, cerebrospinal fluid. And this cerebrospinal fluid, you can test for West Nile virus. All right, you can actually send a test off I believe there's both a PCR, polymerase chain reaction looks for protein, and an immunoglobulin, IgM. If it is the immunoglobulin test, there are false negatives. We kind of wrote that right here. Because immunoglobulins are produced by your B cells, by your immune cells, right? And so you got a B cell here. When it comes across the virus, let's say this is the West Nile virus, it has to take it into the cell, produce antibodies, right? And then it has to secrete those antibodies out into the system. And these are immunoglobulins or antibodies. These could be IgM immunoglobulin. But all that takes time, right? So they actually recommend in patients, if it is an immunoglobulin test with high risk of disease, that you repeat the test in 10 days to make sure that you just didn't try to test for immunoglobulins too early. All right, if the polymerase chain reaction looks for direct viral protein, so that one picks it up more quickly. You also might see signs in the cerebrospinal fluid, pleocytosis, meaning high white blood cells, right? White blood cells can suggest infection, although they're very nonspecific. So high white blood cells in the spinal fluid, for those interested in a little more details, those will typically early on be neutrophils, and later they would be lymphocytes, two different types of immune cells. Neutrophils are part of what we call the innate immune system. This is kind of the early warning system in the body, whereas lymphocytes are more part of the adaptive immune system, which is after the innate immune system gets activated right when it comes across an invader, there's mechanisms that activate the adaptive immune system. So neutrophilia early, lymphocytic later. Viral infections in general often lead to a normal glucose in the CSF, so that's the sugar in the cerebrospinal fluid, whereas if there's a bacteria, this is a virus, West Nile virus. If there's a bacteria, let's say you had streptococcal meningitis, that glucose is usually low because those bacteria use up the glucose, whereas viruses don't use up glucose. And then usually there's an elevated protein in the CSF. Viruses are made of protein just like anything else. So if there's a bunch of protein in the CSF, it can cause an increased amount of protein in the CSF. All right, so there's no definitive way to diagnose West Nile virus, at least not at most hospitals, unless you have neuroinvasive disease, in which case you would need a lumbar puncture or a spinal tap. And there could be kind of studies like the white blood cell count, glucose, protein that could be suggestive of it, but what you would really need is this West Nile virus test in the CSF, a PCR or an immunoglobulin test, to see if you had the neuroinvasive version of West Nile virus. All right, so now we have diagnosed it. What is the treatment? This is probably going to be dissatisfying for people, but the only treatment for neuroinvasive or non-neuroinvasive West Nile virus is supportive care. Okay? What that means is that there is no antiviral that can directly treat the virus. Supportive care is, making sure the patient is hydrated with fluids. If they have respiratory failure, they might need to be on a ventilator. Make sure they have appropriate electrolytes, nutrition, and you support their body while their own body tries to fight off this infection. This is why neuroinvasive disease can be so severe, because there's no way for us to actually treat the virus itself. All we can do is support the body while the body fights off the virus. Which then gets into the second question is, well, okay, if I can't treat it, how do I prevent it? And another dissatisfying answer, there's no easy way to prevent it. There is no vaccine, at least no available vaccine currently, to prevent West Nile virus. The only way to prevent it is to avoid those mosquitoes, right? So if you believe in mosquito spray or long sleeves and long pants at dusk, or avoiding going out when there's mosquitoes around, preventing mosquito bites is the way you prevent this disease. There's no other good way to prevent it. All right, that then gets into the current state of things. Why are we talking about this? Well, if you just Google West Nile virus, there'll be a ton of news articles that'll pop up because it has been spreading. This is in the US, right, as of September 3rd. We're recording this on September the 5th. And what you can see here is that in 2024, there's already been 377 cases of West Nile virus. Unfortunately, 255 of those have been that neuroinvasive disease. And there's probably been more cases, because one might look at those numbers and go, 255, that's not 1 in 150. But there's probably been many more cases of West Nile that we haven't detected, right? Because the symptoms of just normal West Nile virus are just kind of that generic viral syndrome. So if you came to me and I was working at the hospital and you had, a mild fever, some aches, I would probably test you for COVID and flu and RSV and those easy things, but there's no way for me to test you in your blood for West Nile virus. So I wouldn't do that. I would just, say you have a viral syndrome and give you good return precautions. So there's probably a lot more cases than that 377. which is why the neuroinvasive is 255, because the vast majority of cases we detect are going to be that neuroinvasive disease, because in that patient they would get an LP, a spinal tap, and they'd get a direct test for the West Nile virus itself that would come back positive. Okay, there's already been 38 states that have reported West Nile virus, and this is a map over here. You can see there's West Nile virus disease cases reported by state. Dark blue is greater than 25. This kind of light teal is 1 to 5. So you can see the big places here that are reporting a lot of cases are California, Texas. You know, really a good number of the north, southeast, west, southwest. Some of the southeast and the Midwest are reporting a lot of cases. There is some out east, not a lot in the Pacific Northwest, right? All this is mosquito and climate related. And if we want to get even to more detail, this is the total number of human infections by county. The one thing to note, though, is interestingly, they put here non-human activity. So the light green, the teal here, is actually animals that have tested positive, because you can find West Nile virus. You can find it in horses, dogs. There's a whole bunch of different mammals, obviously birds. So these are non-human cases. And the thing to note here is that humans are a dead-end host, as we discussed, right? So where there are many animals infected, you run the risk of human disease. So you can see kind of in Illinois and Indiana here, there's lots of animal cases. And then in what seems to be kind of Chicago and Chicagoland, there's lots of human cases. In California, you can see lots of human cases here with kind of this larger surrounding sphere of teal, which are animal cases. Same thing down in Texas. You kind of get the center dark blue human cases with surrounding teal of animal cases. Out in the Northeast, you see a lot of animal cases, right, in Maine up here, and then you kind of get the smaller sphere of human. Same thing in the rest of the Midwest, human cases and animal cases. So these two things go hand in hand, as one might guess. Where there's animal cases, there's going to be more human cases. All right, so there will probably be more information to come on this. We're going into fall, so there's still kind of prime time for the spread of West Nile virus. Those in a high West Nile virus endemic area, certainly keep an eye on yourselves. Avoid mosquitoes, long pants, long sleeves, bug spray, all that kind of stuff as you see fit. And if you do start feeling sick or having any of these symptoms we talked about up here, it'd be a reason to certainly go and get evaluated in the emergency department, because obviously if you get the severe version of the neuroinvasive disease, no treatment, just supportive care as we talked about. All right, appreciate y'all checking out the video. Let us know what thoughts, comments, questions you have down below. Keep your eyes peeled for the monkeypox episode, and then we'll also do some of our classical kind of medical education videos moving forward as well. So appreciate you. Stay well, keep learning. We'll see you next time.